After 60, there is a kind of pain that many people accept as something they simply have to live, with a deep pulling sensation that starts in the lower back, travels through the hips, and quietly settles into the legs. Sometimes it burns, sometimes it tingles, sometimes it feels like weakness that makes each step uncertain, and over time, what once felt like a small discomfort can begin to steal something much greater: your confidence, your balance, and your freedom to move without fear. What most people are told is to stretch more. Stretch your hamstrings, stretch your lower back, stretch every day. And while stretching can feel helpful in the moment, it does not always address the true source of sciatica nerve pain. In some cases, it can even make the irritation worse by pulling on an already sensitive nerve, creating more tension instead of relief. This is where things change, because what your body often needs is not more stretching, but the right kind of movement. Simple, controlled actions that support the muscles around the spine, reduce pressure on the nerve, and help restore natural movement patterns without strain. What I am about to share with you are 3 simple moves designed especially for adults over 60. They do not require special equipment, they do not demand flexibility, and they can be done safely at home. But more importantly, they work with your body, not against it, helping you reduce pain, improve stability, and regain confidence in how you move each day. Because the truth is, sciatica is not just about pain. It is about how that pain slowly changes the way you live, how you sit, how you walk, how far you feel comfortable going from home. And if left unaddressed, it can quietly lead to reduced mobility, muscle weakness, and a higher risk of falls, which are one of the most serious concerns after 60. But here's the encouraging part. Your body still has an incredible ability to adapt and improve even now. With the right approach, you can reduce that pressure, calm the nerve, and begin to move more freely again. So stay with me, because one of these simple movements often surprises people by how quickly it brings relief and how much it changes the way they feel when they stand up, walk, or even get out of bed in the morning. Now let us begin with the first move, one that may look simple but carries a powerful effect when done correctly: pelvic tilt. For many older adults, sciatica pain is closely linked to tension and imbalance in the lower back and hips. When the pelvis is not positioned correctly, it can increase pressure on the lumbar spine and irritate the sciatic nerve. The pelvic tilt is a gentle movement that helps restore alignment, activate the deep core muscles, and reduce unnecessary strain on the lower back. Begin by lying on your back with your knees bent and your feet flat on the floor, placed comfortably hip-width apart. Allow your arms to rest by your sides and take a slow breath in. As you exhale, gently press your lower back into the floor by tightening your abdominal muscles and slightly tilting your pelvis upward. You should feel a subtle flattening of your lower back against the surface. Hold this position for a few seconds, breathing calmly, and then slowly release back to your natural position. This is not a forceful movement. There should be no pain, only a controlled engagement that feels supportive rather than strained. Repeating this movement slowly and consistently helps retrain the muscles that support your spine, improving stability and reducing the pressure that contributes to sciatic irritation. Over time, this can lead to a noticeable decrease in pain and an increase in confidence when standing and walking. What makes this movement especially valuable is how accessible it is. It does not require flexibility or strength, only awareness and gentle control. And as you continue practicing this simple motion, you may begin to notice something subtle yet powerful. Your lower back feels more supported, your movements feel smoother, and that constant background tension begins to ease. Now, while the pelvic tilt helps restore balance in the lower back, there is another movement that directly targets one of the most common hidden causes of sciatica tightness deep in the hips. For many people over 60, the problem is not only in the spine, but in the muscles surrounding it, especially the piriformis, a small muscle located deep in the hip that sits very close to the sciatic nerve. When this muscle becomes tight or irritated, it can press against the nerve, creating pain that travels down the leg, often mistaken as a purely spinal issue. This is why the second movement can feel almost immediate in its effect, because instead of stretching everything, it focuses on releasing pressure exactly where it matters most. The movement is called seated figure 4, and it is simple, gentle, and highly effective when done with control. Begin by sitting on a stable chair with your feet flat on the floor and your back straight in a relaxed, natural position. Slowly place one ankle over the opposite knee, creating a figure 4 shape with your legs. From here, keep your chest lifted and gently lean forward just slightly until you feel a stretch deep in the hip of the raised leg. This should not feel sharp or painful, only a mild, steady sensation that signals the muscle is being gently released. Hold this position while breathing slowly and evenly, allowing the muscle to relax rather than forcing it to stretch. After a few moments, return to the starting position and repeat on the other side. What makes this movement powerful is not intensity, but precision. It targets a specific area that often contributes to sciatic discomfort without placing strain on the lower back. Over time, this can reduce pressure on the nerve, improve hip mobility, and make everyday movements like walking, standing, and sitting feel easier and more natural. Many older adults notice that after practicing this regularly, the sharp pulling sensation in the leg begins to soften, replaced by a feeling of lightness and control. And perhaps even more important is what happens beyond the physical relief. When the hips begin to move more freely, the body regains a sense of balance and coordination. This can restore confidence in simple actions like getting up from a chair, climbing stairs, or walking longer distances without hesitation. Because sciatica is not only about the nerve, it is about how the entire system of muscles, joints, and movement patterns work together. When one part becomes tight or restricted, the body compensates, often creating more tension in other areas. This movement helps interrupt that cycle, gently guiding the body back toward a more balanced and efficient way of moving. And as this balance returns, many people find that their posture improves, their steps feel steadier, and the fear of sudden pain begins to fade. But even with improved alignment and reduced tension, there is one more key element that many people overlook: strength. Because without strength, the body cannot maintain the improvements created by movement and release. This is where the third move becomes essential, not just for relieving pain, but for building the kind of support that protects your body with every step you take. The third movement is where everything begins to come together, not just relief, but real support for the body in motion, because reducing pain is only part of the process. Maintaining stability is what allows that relief to last. For many adults over 60, weakness in the muscles that support the hips and lower back plays a major role in ongoing sciatica discomfort. When these muscles are not active enough, the spine and the nerve are left more vulnerable to strain. This is why the final movement focuses on rebuilding gentle strength without putting pressure on the joints or forcing the body into uncomfortable positions. The movement is called glute bridge, and while it may seem simple, it activates some of the most important muscles responsible for protecting your lower back and stabilizing your pelvis. Begin by lying on your back with your knees bent and your feet flat on the floor, just as you did in the first movement. Keep your arms relaxed by your sides. Slowly press your feet into the ground and lift your hips upward in a controlled motion until your body forms a straight line from your shoulders to your knees. Hold this position for a few seconds, keeping your breathing steady and your movement smooth, then gently lower your hips back down to the floor. There is no need to rush this movement. The goal is not speed, but control and awareness, feeling the muscles in your hips and lower back working together to support your body. This movement strengthens the glutes, which are essential for maintaining proper alignment, reducing strain on the spine and supporting safe, stable movement in daily life. As these muscles become stronger, they take pressure off the lower back and help prevent the nerve from becoming irritated again. Over time, many people notice that standing feels easier. Walking becomes more stable, and the sense of weakness in the legs begins to fade. This is because the body is no longer relying on fragile patterns of movement, but is instead supported by strength where it matters most. And perhaps one of the most important benefits is the sense of confidence that returns when the body feels capable again. Simple actions like getting out of bed, standing from a chair, or walking across a room no longer feel uncertain but natural and controlled. When you combine this movement with the previous two, something powerful begins to happen. The body starts to move as a system again, balanced, supported, and coordinated. Pain is no longer the center of attention. Instead, movement becomes smoother, more predictable, and more comfortable. And this is the true goal, not just to remove discomfort, but to restore a sense of freedom in how you move through your day. Because when movement feels safe again, life opens up in ways that many people do not expect until they experience it for themselves. But there is something even deeper that needs to be understood, something that goes beyond any single movement or exercise. Because lasting change does not come from doing something once, it comes from what you choose to do consistently every single day. As we move into this final part, it is important to understand that what truly changes the body is not intensity, but consistency. Small movements done regularly create far greater impact than occasional effort followed by long periods of inactivity. For many people over 60, the mistake is not lack of effort, but the belief that relief must come from something complex or difficult, when in reality the body responds best to simple actions, repeated with care and awareness. Each of the movements you have seen works in a different but complementary way. One restores alignment, another releases tension, and the last rebuilds strength together. They create a foundation that supports the body from within. And when this foundation becomes stronger, something begins to shift, not only in how the body feels, but in how it functions throughout the day. Walking becomes more fluid, standing feels more stable, and even sitting for longer periods becomes less uncomfortable. This is because the pressure on the sciatic nerve is no longer constant. Instead, it is reduced, supported, and managed through better movement patterns. But beyond the physical changes, there is also a mental shift that often goes unnoticed. At first, the return of confidence. Confidence in your steps, confidence in your balance, confidence in your ability to move without constantly anticipating pain. This is something that many people slowly lose over time, not because of weakness, but because of repeated discomfort that teaches the body to move with caution. When that discomfort begins to fade, the body relearns how to move freely again, without hesitation, without fear. And this is where true progress is made, not just in reducing pain, but in restoring the freedom that pain once limited. It is also important to remember that the body after 60 is not fragile, it is responsive. It adapts, it improves when given the right signals. Gentle movement, proper activation, and consistent practice send those signals clearly, allowing the body to rebuild strength and coordination over time. You do not need to push your limits, you only need to respect your body and work with it rather than against it. Because every time you perform these movements, you are reinforcing a message to your body that it is capable, that it can improve, and that it can support you in living fully. And over time, these small daily actions begin to add up, creating a powerful effect that extends far beyond the moments of exercise. They influence how you wake up, how you walk, how you carry yourself, and how you experience each day. This is the quiet power of consistency. It does not demand attention, but it creates lasting change. Now, I would like you to take a moment and reflect on what you have learned here today, and consider how you can begin applying even one of these movements in your daily routine. Start small, stay consistent, and allow your body to respond in its own time. If this has helped you in any way, share your experience in the comments and let others know what you are beginning to change in your routine. Your story may be exactly what someone else needs to take their first step toward relief. And if you know someone who struggles with sciatica or discomfort in their legs, share this with them, because sometimes the simplest guidance can make the greatest difference. Thank you for staying with me and taking this time to care for your body. Remember this: your body is still capable of strength. Your movement can still improve, and your future can still be shaped by the choices you make today. With patience, awareness, and consistency, you can move through life with greater ease and confidence than you may have thought possible. As we come to the end of this conversation, there is one idea I want to leave with you, something simple but deeply important, because it has the power to change not only how your body feels, but how you experience your daily life. Pain has a way of slowly shaping behavior without you even realizing it. At first, it is just a small discomfort, something you notice when you stand up or take a few steps. But over time, it begins to influence your choices. You sit down more often, you walk less, you avoid certain movements, not because you want to, but because your body has learned to expect discomfort. And this is how mobility quietly begins to fade, not all at once, but little by little through small decisions made each day. But the opposite is also true. Just as the body can adapt to pain, it can also adapt to relief when given the right conditions. When movement becomes safe again, when the muscles begin to support you instead of working against you, something changes. You start to trust your body again. The trust is powerful because it allows you to move more freely without hesitation, without constantly thinking about where the next discomfort might appear. And this is what these simple movements are really about. Not just reducing pressure on a nerve, but restoring a relationship with your own body, one that is based on confidence, stability, and control. Each time you practice these movements, you are not just performing an exercise, you are sending a signal to your body that it is still capable, still responsive, still able to improve. And over time, those signals begin to reshape the way your body functions. Your posture improves, your balance becomes more reliable, your steps feel more natural. This is not about perfection. It is about progress. Steady, consistent progress that builds quietly in the background of your daily life. And perhaps one of the most meaningful changes happens in the moments that seem small. Getting out of bed in the morning, walking across a room, standing up without using your hands. These moments begin to feel easier. They begin to feel normal again. And when that happens, something else returns as well, a sense of independence, the ability to move through your day without needing to constantly think about limitations. This is what truly matters, not just the absence of pain, but the presence of freedom. Freedom to walk, to move, to live without being held back by discomfort that once felt permanent. So if there is one thing to take from this, it is this. You do not need to push your body beyond its limits. You only need to guide it in the right direction. Small, consistent movements done with awareness can create meaningful change even after 60, even after years of discomfort. Start with one movement practice. Gently listen to your body and allow it to respond in its own time. Because your body is not finished adapting, it is not finished improving, and it is not finished supporting you. It is still learning, still responding, and still capable of becoming stronger, more stable, and more comfortable with each passing day. Now, I would like to hear from you. Take a moment and share what you felt during this video or which of these movements you plan to try. First, your experience may help someone else take that first step toward relief. If you found value in this, share it with someone who may be struggling in silence, because often the simplest guidance is the one that changes everything. Thank you for being here and for taking this time to care for your health. Remember, this aging does not mean losing strength. It means learning how to support your body in a different way. And when you do that consistently, you give yourself the opportunity to move through life with greater ease, confidence, and peace. The choice is always yours, and each day is another chance to take one step toward feeling better.